There's been a nasty flu outbreak in Germany too this winter, and yet in the university town of Aachen there has been no winter flu crisis. Far from it. Yes, A&E has been under seasonal pressure, but in the wards and operating theatres they have not been cancelling operations, and waiting lists are almost unknown. Dr. Christian Bach spent 6 years working in London, Bristol and Newcastle before returning here as a consultant urologist. He believes there are huge strengths in the NHS, but as he examines a patient whose prostate cancer he operated on just yesterday, he certainly notices some differences.
My policy is to keep the patients 6 days in the hospital.
So when you performed exactly this kind of surgery in the UK, how did that compare?
You would be going home now. So we would need to free up the beds, right? So there's already a queue of patients waiting basically to be lying in this bed. It never gets cold.
This is something you don't see a great deal of in the NHS, empty beds. Here they deliberately keep excess capacity to even out the peaks and troughs so that when, for example, a flu crisis hits, they are not turning patients away or cancelling operations. The differences are about a lot more than money. Hospitals here can be privately run, state-run, or operated by non-profit making charities, creating an element of competition, but always free for their patients. The head of Germany's Hospital Federation thinks organisation is more important than just cash.
We are, in a cost-effective sense, very efficient. I cannot explain for myself why the British healthcare system has so much problems compared to the high amount of money they spend in relation to the German system. Indeed, 10% and 11% is not such a high difference that you should have so high problems.
But for Dr. Bach, who can now routinely get patients operated on in less than a week, with almost zero chance of cancellations or delays, his experience points to one overriding factor.
The NHS is actually a very efficient, well-working system. Nobody can deny that, but the main difference seems to be, at least to me, the money the government is willing to give to the system.
The days when the UK spent significantly less than the European average on health are now over, and yet the state of near-permanent crisis in the NHS seems to be a peculiarly British phenomenon. It may be that there is something to be learned from how they're running things on the continent. James Mates, News at 10, Aachen in Germany.